Does Marty do that? He does, but some of the reactions are delayed and then they are not full reactions. And you mentioned you use the stairs in the course of therapy? Yes. Defendant's counsel, objection, leading and suggestive. The court overruled. How do you use stairs in physical therapy? In our treatment area, we have a small staircase with 4 steps and a landing, and then 4 more steps on the other side and a landing 4 steps down. With rails? With rails, and generally I'll have Marty pick a game, and sometimes I'll put part of the game on one side of the stairs, part of the game on the other, and have him go up and down the stairs playing a game. Is he able to negotiate those 4 stairs in either direction? Defendant's counsel, irrelevant. Not safely. The court overruled. The leading is innocuous. What do you mean by not safely? Matthew has difficulty going up and going down, but greater difficulty going down the stairs. How does he walk up a flight of stairs? The manner in which he walks up? Usually holding the handrail step to step. What do you mean by step to step? Defendant's counsel, objection. The court overruled. He takes 1 step at a time. He doesn't do 1 step, 1 foot on each step reciprocally. Would a 4-year-old or should a 4-year-old be able to walk up these stairs, especially those in your therapy center, 1 foot, reciprocally, one after the other? By age 4, a child should be going up reciprocally 1 foot after the other. And what, if anything, on the safety issues does that represent concerning the manner in which he uses stairs? Well, Marty going up step by step, he does that because he doesn't feel secure going up reciprocally. Defendant's counsel, objection. The court sustained. Does he have any trouble walking downstairs? Yes. What are his troubles walking down a flight of stairs? For one thing, he tracks what's called kinesthetic awareness. He doesn't always know where his body is in space, and so, especially if he's not focusing on what he's doing, he can miss the step, he can overstep, and thus causing him to lose his balance and tumble. Defendant's counsel, objection, speculative. The court sustained. What is kinesthetic awareness? What exactly is that? Knowing where your body is in space. How would somebody know, like walking around, where your body is in space? What type of information are you getting from your body that allows you to know that? Kinesthetic awareness, essentially, it's an unconscious thing. Defendant's counsel, objection. The court overruled. You and I, we walk, we put our feet down, we know exactly where we are putting our feet without having to look at our feet. Going up the stairs, you don't look at your feet when you go up the stairs. You just go up the stairs because you know where you're placing your foot. Marty has difficulty with that. And how, if at all, do you treat that type of condition with him? Trying to train him to use his eyes and to focus on the tasks, especially when he's doing stairs. Because he gets very distracted and disorganized, he tends to not pay attention to what he's doing, especially with the stairs. So I try really hard to get him to pay attention, to look at his feet, where he's placing his feet. Are you aware that Matthew wears glasses? Defendant's counsel, objection to form. The court sustained. Does he ever display to you any difficulty seeing when he's wearing his glasses? Defendant's counsel, vague and indefinite. Objection. No. The court, I will allow it. Have you had an opportunity to work with him when he hasn't had his glasses on? Yes. And how, if at all, does that affect him? It just appears from my perspective that he seemed a bit more disorganized. To what, if anything, do you attribute that? We use all of our senses to process our environment, and so when he doesn't have his glasses, that's one less sense he has to process his environment, and thus making him a little more disorganized. Are there any types of devices or prosthetics that you use with Matthew in order to help him with his kinesthetic awareness? The occupational therapy, and I started using a weighted vest. What is a weighted vest? It's exactly what it sounds like. It is a vest with weights in it. Matthew calls it his backpack. How much weight do you put in the vest? Is it able to be altered? Defendant's counsel, objection, irrelevant. The court overruled. It can be altered. To be honest with you, we've never weighed it. I don't know. It feels to me about between 3 and 5 pounds. What's the purpose of a weighted vest? Defendant's counsel, I object. The court overruled. The vest, actually, the little bit of weight that is in the vest sort of gives him some information to his joints, because the kind of weight compresses the joints just so that he's able to feel a little bit better where his joints are in space. And has that aided him in moving around his environments? It helps to organize him a little better during treatment sessions, and he wears it on occasion in the classroom. You've mentioned the term organized. What do you mean by the term of organized in terms of what you do with Matthew? What are his organizational issues? Defense counsel objection. The court overruled. As I said before, we use it in our senses to process our environment and to organize our environment. With Marty, I try and get him to use all his senses in order to organize his environment because he becomes so distracted. I try and keep him focused right in to what he's doing. Now, does Matthew have any physical reactions with his body with regard to his balance issues? I'm not sure what you're asking me. Okay, dynamic foot reactions. What are they? Dynamic foot reactions are, one of the things is called an ankle strategy. When you lose your balance, you, yourself, anybody, the first thing that kicks in is something called an ankle strategy, where your ankle and the muscles around the foot and the ankle in the calf react to your losing your balance and help to regain your balance. Does Matthew do that? He does, but he has delays in his balance reactions.